Welcome back to another PT Pro from the Optimal Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today we're going to be talking about the benefits of HIIT, or if you should be doing HIIT exercises, which is high intensity interval training. So much we're about to go over, so let's dive in. HIIT is something that kind of gets a bad rap.
Totally. People are so afraid of it.
People are scared of it because of aches and pains in the body. They don't like the high intensity nature of it. They don't like sweating or something like that. But I think it's so beneficial for people to know all the benefits in all the systems of the body that you can get from doing high intensity training, especially as we age. And something that we're super excited about is Jen just recently collaborated on a program with Jill Miller from Tune Up Fitness, where Jill educates in her expertise, which is myofascial release, using tools to help prep the body for exercise and then also recover afterwards. And then we have HIIT workouts that are going to be progressive by difficulty level that Jen is educating the whole time, so you know the level that's appropriate for you, so you know how to do the movements without getting injured. There's a link that's down in the description of this YouTube video, as well as hopefully appearing somewhere on the screen, that you can learn more about that or get into the program again. And you're going to want to after hearing all the benefits of HIIT. As always, comment below if you have any thoughts on HIIT. If you hate it, if you love it, please subscribe and hit that notification bell. And now let's get into it.
Yeah. Let's talk about all the benefits, because I think a lot of people are afraid of this. Like, as soon as you hear HIIT, it's this either a buzzword or you think it's not good for the body. There's just so much.
I feel like everyone thinks about jumping. Like, as soon as you hear the word HIIT, it's like so much jumping, so many burpees, so much, knee pain, back pain. That's when the thing people might be triggered, because they're like, oh, a HIIT workout, I did one of those once and it was really rough on my knees, or it was really rough on my back. And
really all HIIT it's interval training. So you're alternating periods of relatively intense work with periods of rest. Intense work doesn't have to mean jumping. This can be so many different areas of exercise that you're doing, including intense walking and then periods of rest.
And I think the key word there is relative. Like, intensity is always going to be relative to the person, because what's intense for me is not the same thing that's intense for my mom, is not the same thing that's intense for Jen. And so again, depending on the type of interval training that you're doing, we're looking at getting to like 80 to 90% of your max for whatever period of time. And we're going to talk about why that's so beneficial to be pushing up towards your max intensity for all the different systems of the body.
Exactly. We're going to go over your cardiovascular health, your metabolic health, your musculoskeletal health benefits, the lymphatic, the neurologic system, and then how these are really impacted, especially as a lot of those benefits are so needed as we age.
Yeah, because again, as we age, people are always thinking of these things like, oh, my knee pain, or oh, my back pain, or oh, I'm losing muscle mass. That's where I love the Roll Into HIIT program that you collaborated on with Jill, because you go through those different intensities. And the great thing about each video is that you're doing the most intense version. There's another guy, Adam, on screen who's incredible, but he's doing kind of the middle intensity. And then Jill's doing a lower impact but intense version of the exercise. We'll have the Roll Into HIIT program linked up down in the show notes. Get into that. If you're somebody who doesn't like high intensity training, or even if you do like HIIT workouts, but sometimes you notice some knee or back pain creeping in, this is an incredible program. Jill's got her expertise where she's doing myofascial release and rollouts. Jen has her expertise where she's educating through all the different levels and intensities of different HIIT programs.
And there's different time intervals of what we use. And it's just really about finding those overall body movements as to what's going to be most beneficial as you're kind of moving through this, and why.
It's been found that HIIT is so much more effective if you do 20 minutes of HIIT versus 20 minutes of steady state cardio. You're going to have so much more benefit on your cardiovascular system in improvements in your heart rate, your blood pressure, your VO2 max, things like that, by doing HIIT versus just steady state cardio, which would be like running on a treadmill or riding a bike.
Well, because if we think about it, it's the same, like, let's look at strength training and how much we have to overload the system in order to start to make changes. Well, when we're doing high intensity training, we are making our blood vessels really have to pump and move blood and constrict constrict and dilate and do all these things at a higher rate and a higher intensity. So all of a sudden, we're going to help to improve what's called our endothelial function and how these vessels are moving, dilating, and constricting to help pump that blood and push that blood through the body. Sure. So then we're getting more oxygenated blood into our system.
Yeah, it benefits every part of the chain when it comes to our cardiovascular system. Like you said, the compliance of the vessel, the strength of the heart, our ability of our lungs to get the oxygen in. So really, this is like the cardiorespiratory and cardiovascular system bundled into one. But these are also things that we see as we age. When we get past 25 years of age, we notice that our VO2 max, which is just a kind of a biomarker that tells us how much oxygen our lungs and our heart can deliver to our tissues when we're doing work, will decline by 10% each decade if we aren't doing some proactive training like this.
Yeah, and there was actually a study that looked at HIIT training 3 times a week just for 8 weeks and how it improved the VO2 max capacity by 12%.
Yeah.
And essentially that's like saying that we're reversing your age by a decade
plus
by improving your VO2 max in 8 weeks. Of HIIT training. That's what's crazy to me.
Definitely. So like you think if you're declining 10% a decade by not doing any training like this and you just train for 8 weeks, you give yourself another decade back basically. Yes. And of course, hopefully then you sustain some of that high intensity training because of how amazing you feel in your body. But there are also tons of metabolic benefits, which when we talk about metabolic, you think metabolism. And one huge thing in metabolism is insulin or glucose regulation. You know, when we kind of think diabetes or type 2 diabetes, how our body uses our fuel stores, because glucose is stored in the blood, in the muscles, in our liver as glycogen, and then it gets used up by the muscles as we do work. And when we do such high intense training, like in HIIT workouts, we actually increase our insulin sensitivity. So our body's much more ready to take up glucose that's in the blood. And some of the studies showed that it doesn't have to be a high volume. You don't have to be doing this 4, 5, 6 times a week. Like a low volume goes a long way, especially if, like you said, it's progressively overloading you. I mean, and when we talk about the relativity of what's intense for one person, like high intensity interval walking was shown to be much more effective than moderate exercise over a 12-week program in improving this insulin sensitivity and insulin regulation or glucose regulation.
Know that there's always modifications. You don't have to be doing all the jumpy jump stuff during a HIIT workout for you to still find that higher intensity and work at that higher capacity with those rest breaks and still be doing that interval training.
Something that's very common is what we call sarcopenia, which is progressive loss of muscle mass as we age. And we've talked about this before on podcasts. It's like they say, I don't even know what the stat is, but beyond age of 40 or something, you're losing 1% of your muscle mass every year.
Muscle mass decreases approximately 3 to 8% per decade after the age of 30.
After the age of 30.
Which is pretty young, right?
Yeah. And again, I think we've mentioned this on podcasts before, like, so those are averages, right? But we all know, or we might have someone in mind who has started strength training or has started doing high intensity training in their late 40s, 50s, or even beyond, who has gained muscle mass. Like it doesn't mean it's a sure thing. Like no matter how much you train, no matter what you do, you're going to lose this muscle mass. And this is where high intensity training comes in. You can prevent or reverse this loss of muscle mass as you age by pushing the body in a systematic, progressive way. Also in a way, like when you were talking about Jill, that prevents the loss of power. Power is how fast we can move in a controlled manner. Power is so important. When we worked in hospitals, the first thing you start noticing is people can't get up from a chair or a toilet. That's a lack of power.
Yep.
Often they might have the strength, but they don't know how to coordinate that in a fast, high velocity manner to even get up from a chair.
And that's what's going to increase our fall risk. That is what's going to potentially lead to death. Like fall risk is so highly important as we continue to age because we see such a higher percentage of people starting to die earlier. If you fall, you can't get off the ground, or you break something and you don't have someone around you to help, like it does have a huge impact, and we need to start paying attention.
Everybody listening to this, at least I hope that they're going to be 60 or 70 or 80 years old someday, right? And like we've mentioned, these declines can start in our 30s, in our 40s. So if we're training now, we're just elevating that baseline that we have to build on or to maintain into our old age. And as we age, again, if we do have a fracture or a need for a surgery or a need for a joint replacement, having that strength and power going into surgery drastically really improves your prognosis for being able to get back to function after the surgery.
A lot of people we know listening are women, and we will eventually go into menopause, perimenopause, postmenopause, right? Especially postmenopausal, we are reduced in estrogen a lot, and estrogen is so important to help with muscle strength.
Yeah.
And so after we lose that, we tend to lose muscle strength. We tend to lose that elasticity within the tissues. We start to see a little bit more hip fractures, joint replacements, and a decrease in that VO2 max. And so if we want to start to work on these things, we have to start now. Even if you're already gone through menopause, right? We have to still start now.
Another important system of the body that we've definitely mentioned before on podcasts is the lymphatic system, or the garbage sewage system of the body. It's what works along with our circulatory system, but it essentially takes toxins out of our body and pumps them through. But when I say pumps them through, it's not an active pumping system. The passive system, which means it's pumped by our movement, by our muscle contractions, by our breath. So doing something like high intensity work gets us pumping those muscles a significant amount more than we normally are, which is going to move that lymphatic system.
Especially when we focus on HIIT, particularly using those larger muscle groups or whole body kind of movements and stuff. And that's usually what you're doing when you're looking at HIIT training. You're looking at those more power dynamic whole body movements.
Not
We're
a lot
not
of
usually
bicep
just
curls.
Exactly, that's what I was going to say.
Not a lot
just,
of bicep curls.
Just doing a bicep curl or moving your leg. You know, you're doing a whole body movement, and so this is going to be so beneficial in getting that whole contraction to happen from your body in order to help to pump those fluids.
Yeah, and then one of the final systems to talk about is the neurologic system, brain, nervous system. Doing HIIT workouts has been shown to significantly increase what's called our BDNF, or our brain-derived neurotrophic factor, which is basically just a powerhouse hormone for the brain.
Yes.
To increase our mental acuity, to increase brain healing and cognitive function.
We're going to be improving how we're getting our blood flow out into our body. We're also including that up into the brain. So if we're getting better blood flow and oxygen into our brain, then we're going to help those neurological systems, especially as we age. We're looking at a decline in our brain to be able to work, right? And we're all afraid of going into Alzheimer's and different things, and not that we can say we didn't find a direct study to correlate HIIT training and
reducing risk of neurodegenerative disease.
Right. However, they can deduce, because we're kind of, helping with that increased blood flow, that circulatory system up into the brain, well, then we're going to help oxygen and still power the brain.
Those studies are really hard to do because you need to follow people for 20 to 30 years and
doing the same thing,
doing the same exercises, or, retrospectively look back. Did you do HIIT training?
Right.
Did these people? So again, it's hard to get definitive studies to say that, but because we can deduce from the physiologic benefit of increased oxygen delivery, increased lymphatic flow, increased, delivery of the blood around the body with lower blood pressure, better working heart, like, it only makes sense to me to say that we're likely putting ourselves at less of a risk, or, just setting our body up better to be able to deal with whatever it encounters in the future. Last thing about the neurologic system was that it's not time dependent. You don't have to be doing HIIT workouts for 30 minutes. Like, even if you do 10 minutes of high intensity training, you're going to see that increase in the brain derived neurotrophic factor. Even short intervals, short amount of times, getting your body to a high level of intense work, you're going to see benefits.
And the number one thing I will say when it comes to HIIT workouts that people are afraid of is getting injured. Yeah. And they already have knee pain. I can't do jumps. I can't do different things. Well, we want to help to prevent those knee pain, but also improve that knee pain or any pain that is happening throughout the body, and prevent potential joint replacements, or help you thrive after a joint replacement. And this doesn't just include just muscular strength training, but also including that power. And that's really what we're doing in Roll Into HIIT, especially when you're with me. Like, trust me, I got you. We have so many modifications and progressions based on whatever level you feel comfortable with. And there's actually an assessment that you can do to figure out, okay, who am I following through each of these videos, so I know exactly who I'm looking at and exactly what I'm doing as I'm going through the videos.
If you're interested in getting in that, the link is down in the show notes. We hope you join, and we hope you start training your body in a way to get all the benefits that we just talked through.
Thank you so much for joining us. I hope you learned a lot about what benefits of HIIT will really do within your life if you start to add it in. And if you need assistance and help with how to add it in, or you're a little scared because of injury, please get into Roll Into HIIT. We're going to have that linked up so that you can feel confident within your body as you're starting to improve your power and so many different systems within your body.